I've never seen a diamond in the flesh. I cut my teeth on wedding rings in the movies, and I'm not proud of my address.
Hello, we are Daniela Garcia, Daniela Montemayor, Brenda Cantú, and Melissa Saldívar, and we will present some parts of the urinary system and one of its diseases.
This is an image edition that we did about the urinary system of men. We have the two kidneys, the ureters, the urinary bladder, and the urethra. The two kidneys filter the blood, and they produce urine. The urine travels through the ureters, then to the urinary bladder, and then it goes out of the body through the urethra.
This is the image of the women. It has two kidneys, the ureters, one bladder, and one urethra.
And now I will show you a podcast we did about the urinary system, explaining it in a more elaborated way.
Hello, we are
Daniela Garcia,
Daniela Montemayor,
Brenda Cantú,
and Melissa Saldívar, and we are going to explain you what happens step by step in the urinary system.
The urinary system is the one in charge of producing, storing, and eliminating urine. This is very important to the body because it gets rid of waste and unnecessary water and salt.
The urinary system begins in the kidneys, which produce the urine. The kidneys are tube-shaped organs.
Then the urine that the kidneys produced goes to the urinary bladder through the ureters. The ureters are two tubes, one from each kidney, that connect the kidneys to the urinary bladder.
Once in the urinary bladder, the urine is stored until the body releases it. The urinary bladder, which is a hollow and elastic organ.
When you are ready to release it, the urine goes out of the body through the uterus, which is a tube that connects the urinary bladder to the external genitalia.
The sphincter muscles are what controls when the urine is released. When one of these two muscles contracts, the urethra is closed.
These two muscles are the internal sphincter muscles and the external sphincter muscles. The internal is smooth and involuntary. It prohibits the release of the urine.
The external is voluntary and it controls the flow of urine through the urethra.
All these organs together make the urinary system.
We got this information from the webpage manatomy.com.
Thanks for watching.
And now we will show you a video of one of the most common diseases in the urinary system that are kidney stones.
We're Daniela Montemayor, Daniela Garcia, Brenda Cantú, and Melissa Saldívar, and we will talk about kidney stones. First, some history about the kidney stones. The first kidney stones were found in ancient Egyptian mummies. Surgery to treat kidney stones was first described in the 8th century by an Indian surgeon. In the Middle Ages, surgeons called lithotomists traveled around Europe performing surgeries to men that had bladder stones. But during this time, there were no antibiotics or anesthesia, so a lot of men died during the operation. Modern surgery was first performed in the last half century. The first modern surgery for kidney stones was done in 1976.
What is a kidney stone? A kidney stone is a small stone that forms inside a kidney. Little problem until it gets to one of the urethra, which is the tube that connects the urine from the kidney to the bladder. So, that stone will block the urine, which makes the draining in the kidney not possible, and it causes severe pain.
What is the treatment? If it is your first stone, the doctor may recommend home treatment, which consists of taking the medicine for the pain and many fluids. If it's not your first stone or you think you can't handle the pain, the other way is to have a surgery. Have extracorporeal shocks named lithotripsy, which consists in strong waves shock that break up kidney stones. You can also have an ureteroscopy, in which the surgeon inserts a tool in the urinary tract that consists of breaking up the stones into small pieces for easier removal.
Are there ways to prevent a kidney stone? If you had a kidney stone before, it's very possible that you will have another one soon. There are ways to prevent that, and if you have never had a stone before, this will work.
The first one is to drink plenty of water, at least 8 standard 8-ounce cups. You can also include lemonade and orange juice, since the citrate in these beverages helps block stone formation. Next one is get the calcium you need, but obtain it from your food because some studies have linked calcium supplements to kidney stones. Another measure is to reduce the sodium because it can increase the calcium in your urine, and calcium can cause oxalate levels to rise and cause kidney stones. Third one is limit your annual protein. Don't eat more meat than a pack of playing cards, which will help you also with your heart. And the last one, which is only for the people that have had stones before, avoid stone forming food like chocolate, spinach, tea, and nuts.
Thanks for watching, and we hope this was
The urinary system produces, stores, and eliminates the urine, letting all those wastes leave our blood and therefore our body through it. Without the urinary system, our blood will retain water. Therefore, it will not let it or any other organ get rid of the toxins. Eventually, our immune system could fail apart or break down. So basically, the urinary system is important because somehow our body needs to get rid of all the wastes.
Thank you for watching.